They were all in a crisis and turned to a major Detroit hospital to help stabilize them.
But after being admitted, police say 2 patients were sexually assaulted and another was able to take her own life.
Well, last week, 7 investigator Ross Jones revealed what went wrong inside Detroit Receiving Hospital. And now local leaders are demanding answers, calling for outside investigations.
These are serious system failures, absolutely. If not system failures, what is it?
What broke down inside Detroit's busiest hospital, allowing 2 psychiatric patients to become crime victims and costing a third her life, remains a mystery tonight, months after it all happened. But tonight, a member of Congress and leaders from the largest community mental health organization in the state say that needs to change in wake of a 7 News investigation.
It's quite alarming that could take place in a major hospital that we pay for all the behavioral health clients that are there.
These incidences are occurring too frequently, and unfortunately, people are losing their lives.
As we first reported last week, police records show that a patient admitted to Detroit Receiving's crisis center earlier this spring was sexually assaulted by another male patient while she was sedated and in 4-point restraints. Surveillance video showed the assault took place for about 5 minutes before a staff member intervened.
The patient standing over the patient with his hand in her ear, period.
Only a few weeks later, an almost identical assault took place in the same unit when a pregnant woman, also in 4-point restraints, reported she was raped by a different male patient. And later that same month, a 21-year-old woman who came to Detroit Receiving Hospital after a failed suicide attempt was able to successfully take her life in her own hospital room with staff just steps away. Current and former hospital employees say the tragedies were made possible largely due to chronic understaffing inside Receiving.
Lack of security, lack of staffing. The patients are not in a safe environment, and you don't have adequate staffing to make sure that that happens.
Jonathan Kinlock is a Wayne County Commissioner and a board member of the Detroit-Wayne Integrated Health Network, or DWIN, which pays for thousands of mental health consumers in Wayne County to seek treatment at Receiving Hospital. Both of the patients alleging rape are DWIN clients. Following our investigation, Kinlock sent this letter to the Mental Health Network's interim CEO, requesting a comprehensive review of the 3 incidents to ensure that the county can take appropriate action to prevent any recurrence.
This is very concerning, and it just seems like at this point that someone needs to probably step in and get some serious answers.
I was infuriated. I was disgusted with what happened.
Congressman Shri Thanedar wants answers too. Detroit Receiving Hospital is in his district, and this week he requested an investigation by the Secretary of Health and Human Services, calling it imperative we understand the root cause of such disturbing events.
Clearly, the hospital does not seem to have adequate staffing processes to protect these very, very vulnerable patients. And that's heartbreaking.
The congressman was also troubled by something else our reporting revealed, that according to the mother of one of the patients abused, she says she was offered $350,000 by hospital executives in a meeting that followed her daughter's sexual assault.
I think they were trying to bribe me. I think that they were trying to coerce me into making it sound like they were doing something really good for my daughter.
In a separate lawsuit, a now former DMC nurse who says she was fired for blowing the whistle on unsafe conditions says hospital officials offered another abused patient an undisclosed sum of money in exchange for not suing the hospital. If confidential deals like that are being made, Thanedar says he wants to bring them into the light.
We want to know. We need to really understand. It almost looks like this may be a cost of doing business. And it should not be handled that way.
We asked Detroit Receiving Hospital whether it's made any changes to staffing, patient monitoring, training, or other hospital operations after these 3 tragedies. Through a DMC spokesman, they declined to comment. I'm Ross Jones, 7 News Detroit.
Okay, Ross, thank you. Now, anyone experiencing thoughts of suicide or mental health issues can call or text Suicide and Crisis Lifeline at 988. Help is available 24 hours a day, 7 days a week.